Many people with psoriasis have wondered whether what they eat can affect their skin. Diet can affect skin conditions like psoriasis, but can eliminating certain foods help psoriasis clear? Hi, I'm Dr. Jennifer Soung. I'm a board-certified dermatologist and clinical researcher. I specialize in treating serious skin conditions. And today we're going to learn more about how food can impact your skin. Healthy skin is a reflection of your internal health. There are two important reasons why diet is important in treating psoriasis. Number one, it can lessen the severity of your psoriasis. So it's a supplement to your medical treatment and not a cure for your disease. And number two, it can reduce your risk of heart disease and diabetes. There's a large body of scientific evidence showing that being overweight increases your risk of developing psoriasis and makes your psoriasis worse. Did you know that excess fat is also pro-inflammatory? Fat serves to store excess energy and unused calories, but also releases many inflammatory proteins that make psoriasis worse. Having a healthy weight is important because patients with psoriasis are at higher risk of developing heart disease, diabetes, high blood pressure, and fatty liver. So it's really important that changing your diet can be an important part of preventing these health problems and improving your skin. Recently, the National Psoriasis Foundation Medical Board published guidelines on psoriasis and diet. The guidelines are based on over 55 studies and over 4,500 patients with psoriasis over the last 3 years. The first key finding is that weight reduction with a low-calorie diet in overweight patients. Many studies have shown that losing weight by itself can improve your psoriasis. Easier said than done, right? It doesn't cure your psoriasis, but definitely can reduce the severity of your psoriasis. How do you know if you're overweight? Overweight is defined as a body mass index of over 25. This is calculated based on your height and weight. Number two, smoking and alcohol. Too much alcohol can also be clearly triggering your psoriasis. What about gluten? Gluten can be a trigger in a small number of psoriasis patients who also have a condition called celiac disease. Clues to celiac disease are stomach pain, diarrhea, or certain nutrient deficiencies, like iron deficiency. In this situation, your doctor might order a blood test to check for gluten or refer you to a doctor that specializes in issues with the gut. So patients ask me, really, Dr. Soung, is that just the story with gluten? In some situations, patients say they just feel better on a gluten-free diet. This is probably a gluten sensitivity rather than a true allergy, as in celiac disease. Staying away from gluten in these situations can definitely help. And what about supplements? Based on limited available studies, the medical board does not recommend dietary supplements like fish oil, vitamin D, selenium, and vitamin B12. A survey of over 1,200 psoriasis patients by the National Psoriasis Foundation, patients reported several different types of diets as improving their psoriasis symptoms. These were the Pagano diet, based on the idea that psoriasis is caused by a toxic buildup or leaky gut, the vegan diet, the paleo diet, gluten-free, or low carbohydrate, high protein. The scientific evidence showing which of these diets is most effective at psoriasis is not yet known, but the common thread of all these different diets is that they lead to weight loss. So there's no easy fix for psoriasis, and diet alone is not a cure, but definitely lessens the severity of psoriasis. So what should you eat? Diet is a little bit like religion. It's personal, and it's tied to your cultural and social habits. There's no one-size-fits-all approach, so you'll have to pick and choose what works for you. Are there specific foods, nutrients, or diets better for psoriasis? Great question. The medical board of the National Psoriasis Foundation recommends to consider a Mediterranean diet with extra virgin olive oil as the main cooking fat. This means lots of vegetables, fruits, fish, seafood, and nuts. Here are my personal tips for diet because I want you to make changes for the long term and become a new way of life. What works for one person may not work for another, so it may take some experimenting, so consider keeping a food journal or consulting a dietitian. First recommendation is portion sizes. I just came back from Europe from the World Congress in Dermatology meeting and saw the difference in European portion sizes and American. Yes, it is true. In America, everything is supersized. So a great way, an easy way to start by losing weight is eating smaller portions. Consider filling half of your plate for dinner instead of the entire plate. Eat only half your sandwich. This is an easy way without eliminating the foods that you love to eat. Number 2, low glycemic foods. These are foods that are slowly digested and cause a slower and smaller rise in blood sugar. So that means instead, eat whole fruits, not fruit juice, and eat whole grains and not processed and refined grains like white bread. Number 3, exercise. Exercise is so important. It's a great way to continue to lose weight and also reduce your risk of heart disease. That doesn't mean that you have to go out and sign up for the gym or start Peloton, but something easy as brisk walking for 30 minutes every day is a great way to start. 4, eat fish. Fish is important because there are special fatty fats that help reduce heart disease and inflammation. Number 5, use nut oils like avocado, peanut, and olive oil for dressings and sauteing vegetables. This is much healthier than using animal fats like butter. Number 6, spice it up. Turmeric, a popular spice in curry, can fight inflammation in psoriasis as well as psoriatic arthritis. Herbs and spices also have antioxidant properties that can help lower inflammation. Number 7, eat a rainbow of fruits and vegetables. So these include squash, kale, salads, different types of salads, figs, mangoes. This is really important so you can get a variety of vitamins that also serve to fight inflammation. Diet is an important part of treating your psoriasis. It's not a cure, but it's a supplement to your medical treatment. If you want to learn more about psoriasis and other serious skin conditions, please subscribe to my channel. Thanks for watching.